Hello, welcome to the College of Registered Nurses of Newfoundland and Labrador and the College of Licensed Practical Nurses of Newfoundland and Labrador collaborative presentation on scope of practice, the collaborative practice between registered nurses and licensed practical nurses. My name is Wanda Squires. I am the practice consultant with the College of Licensed Practical Nurses of Newfoundland and Labrador. And with me today is my colleague from the College of Registered Nurses of Newfoundland and Labrador, Rolanda LaValle, consultant.
CRNNL. CRNNL is the regulatory body for over 6,000 registered nurses and nurse practitioners in this province. The mandate of CRNNL is to protect the public through self-regulation of the nursing profession. The college's strategic outcomes to meet this mandate is public confidence in self-regulation, accountable professionals, and evolution of the profession so that the profession is prepared to meet the future needs of the population.
About the College of Licensed Practical Nurses of Newfoundland and Labrador. So the College of Licensed Practical Nurses of Newfoundland and Labrador, well, some refer to us as CLPNL or the college. Well, we're the regulatory body for approximately 2,400 LPNs in Newfoundland and Labrador. The mandate of CLPNL is to promote safety and protect the public through the provision of safe, competent, compassionate, and ethical nursing care by licensed practical nurses. Self-regulation is a privilege granted to a profession. It recognizes that nursing professionals have the knowledge and expertise to regulate themselves as individual practitioners and to regulate their profession through their college. All nurses use legislation, regulations, standards of practice, employer policies, and other requirements to regulate their practice in the public interest. We must always remember that you own the license to practice. Therefore, my practice is my responsibility.
The focus of our presentation today is scope of practice, and specifically the collaborative practice between registered nurses and licensed practical nurses. What exactly is the formal definition of scope of practice? Scope of practice identifies the boundaries of a discipline. And scope of practice is the range of roles, functions, responsibilities, and activities in which registered nurses and licensed practical nurses are educated, competent, and authorized. The three words educated, competent, and authorized are in blue on this slide, and they will be further explored as we proceed through this presentation and discussing scope of practice. The authority to set the scope of practice for the College of Registered Nurses of Newfoundland and Labrador comes from two pieces of legislation, the Registered Nurses Act and the Registered Nurses Regulations.
The authority to set the scope of practice for licensed practical nurses in Newfoundland and Labrador lies within the LPN Act and also the LPN Regulations.
Are there limits on an RN's scope? The RN Act does not limit or differentiate the type of client a RN is authorized to care for or the environment where that care occurs. So within their scope of practice, RNs may autonomously provide care regardless of the complexity of client care or the predictability of client outcomes. CRNNL does not maintain a list of competencies due to the individual and changing nature of RN scope of practice.
So are there limits on an LPN scope of practice? And the answer to this is yes, there are limitations. The professional scope of practice can be found in the Competency Profile 2019 document. This document outlines all of the skills that can be within a licensed practical nurse's scope of practice. That does not mean that every LPN will have all of these competencies found within this document. Within the competency profile, you will notice that all the competencies at entry level practice are in normal print. However, competencies that are beyond entry level are italicized. It is also very important to take the time to read through the introduction as it sets the stage for the document. It identifies the framework in determining if a skill is within LPN scope of practice. Appendix A in the back of the book is also a very important section. It identifies factors to consider in determining the level of independence in your practice. For example, what are the needs of your client? Where is practice taking place? Can you manage those outcomes of care? Am I the right nurse with the right skill set in the right place to carry out this care? This document is electronic. It can be found by visiting the CLPNNL website at www.clpnnl.ca. I do not recommend printing this document as it is 260 pages, and when updates are made, the most recent update will now live within the online version. So if you ever have questions around something within the competency profile, you can always reach out to the College of Licensed Practical Nurses. Now let's have a look at these circles. The first little circle that you see there is what we call entry to practice competencies. Those are the competencies that you, as a registered nurse or licensed practical nurse, would have acquired when you graduated from your BN or your PN program. Then, as you move out into your working environment, you then have what's called my individual scope of practice. And what we mean by individual scope of practice are the things that you yourself are educated, authorized, and competent to do. The outer blue circle, that's all of nursing scope of practice. So you could at times go out and grab something from that area and bring it back into your own scope of practice. For example, advanced foot care. So education and advanced foot care lies within that outer blue circle. It's not entry level practice for registered nurses or licensed practical nurses, but it does lie within that outer circle. So if you obtain that education, you are authorized to do that. You bring it then into individual scope of practice. So just keep in mind that we all graduate at different points in times. We obtain different knowledge from various areas. So we all have different individual scopes of practice. Not two people will have the exact same individual scope of practice. So that's why it's very important to ask, do I have the education? Am I authorized? And am I competent to carry out this care? Let's break it down a little bit further. So the three words that Rolanda had mentioned earlier: education, authorized, and competent. So in order to carry out care, or if you're ever questioned, can I do this? I'm not quite sure. Well, you have to stop and think, right? Do I have the knowledge, skill, and judgment to carry out this care safely, competently, and ethically? And can I manage those outcomes of care? So the education component either came from your entry level education, so whether that be your BN program or the PN program, or you learned it through continuing education. So that could be more formalized, where you were in class, you obtained a certificate, you were graded on something, or informal. It could be as simple as looking up a new medication that you're unfamiliar with. So keep in mind that before you provide any type of care, you need to have the knowledge, skill, and judgment. You need to have that education in order to carry out that care. Then there's the authorization component. So your regulatory body must authorize you to carry out that care. So it has to be within your scope of practice, whether you're a registered nurse or a licensed practical nurse. For licensed practical nurses, you could always look into the competency profile, and because it does outline what could be within an LPN scope of practice. And again, if Any questions, you could give us a call at CLPNNL. Then there's the authorization piece from your employer. So your employer must support you to carry out that care, but in that setting. So your employer will have policies to support you in practice. If there's not a policy, it's important to advocate for a policy to support you in that practice setting. Um, but it's also very important to understand that even though sometimes there's what I call overarching policies, there could also be area specific policies or building specific policies, meaning you may be authorized to carry out that care in one particular setting. But if you move to another setting, you may not be authorized to carry out that care. And sometimes that depends on, if you can manage those outcomes. Is it safe to do it in one particular setting over another? Because we want the best possible outcome for our clients. So again, that authorization, the regulatory body, the employer, but then there's the law. So there must not be anything in legislation that would prohibit you from carrying out that care. So just be mindful of different pieces of legislation. It's important that you know your LPN Act, you know your Registered Nurses Act, but other components of legislation also. And then the third arm there is competent, right? You have to be competent in order to carry out that care. So if you're missing one of those three words when you're asking those questions, am I allowed to do this? Can I do this here? Well, then if you're missing one of those three, then you shouldn't be carrying out that care. You can't do that. So it's one thing to have the education, it's another to have the authorization, but the competent pieces, you need to know what best practice is today, because you may have done the education 10 years ago. You may be supported and authorized to carry out the care. However, I don't know what best practice is today, so I'm not competent. So you would need to regain that competence back. It doesn't necessarily mean that you have to go back to school and do a huge program, but you do need to become competent. So whichever way that it's going to help you to become competent, that's what you need to do. So always ask yourself, am I educated? Am I authorized? And am I competent? And can I manage those outcomes of care?
There are similarities and differences between the scope of practice of registered nurses and licensed practical nurses. We will focus on the differences in this slide. The differences between the scope of practice of the two groups is based on the breadth and depth of each education program and the legislation, which we've already referred to, which is the Registered Nurses Act and the LPN Act. The education for the LPNs is that you graduate from a 4-semester, 16-month diploma program, and RNs graduate from a 9-semester, 4-year degree program. So the application of knowledge for registered nurses is more in-depth and comprehensive, which is reflected in the broader scope of RN practice based on the length of the education programs themselves. And another difference is the legislation. So the Registered Nurses Act does not limit or differentiate the type of client a RN is authorized to care for or the environment where that care occurs.
So when it comes to the Licensed Practical Nurses Act, there is an area within the Licensed Practical Nurses Act that identifies a licensed practical nurse, who a licensed practical nurse can care for, whether that be independently or collaboratively, depending on the complexity of the client. So let's have a look at the first area there. So first, a licensed practical nurse is a person who undertakes or performs duties or services relating to the care of clients that's consistent with his, her, or their training as approved by the council or the board at CLPNL. So I think of this as independent practice, meaning the licensed practical nurse is caring for a client who has a plan of care in place, and that client is meeting the anticipated outcomes within the plan of care. The licensed practical nurse may not need to collaborate with the registered nurse, physician, or the nurse practitioner because the client is meeting those outcomes of care. So, second, a licensed practical nurse is a person acting under the direction of a registered nurse, a qualified medical practitioner, or a member of a healthcare profession approved by the minister. So, this tells me that this particular client has outcomes that are unpredictable. This could be a client who presents to the emergency department unconscious. The registered nurse would be assigned to this client as the client has outcomes that are unpredictable. We do not know what's going on with this client. The licensed practical nurse can also participate in the client's care, acting under the direction of the registered nurse, nurse practitioner, or physician. This care could include putting in an IV, administering medications, working within their own individual scope of practice. Those components of care that the LPN is educated, authorized, and competent to perform.
In respect to similarities in the scope of practice between registered nurses and licensed practical nurses, there are competencies that both registered nurses and licensed practical nurses possess, and these are called shared competencies. So they include task or care such as assessment, complex dressings, removal of sutures, catheter care. So this is just a few examples of shared competencies. And as a result of these similarities and differences that we have discussed, considering the scope of practice of the entire team is vital. As this slide depicts of these circles that are overlapping, is that there's portions of the circles that are overlapped, there's portions of the circles that don't overlap, but the majority of the circles overlap. So therefore, our scope of practice, our individual scope of practice, the scope of practice of the profession, and how we function as a team gets us to meeting our end goal, which is meeting the needs of the client. The consideration of the scope of practice of the team is achieved through collaboration. And the formal definition of collaboration is practicing together with one or more members of the healthcare team, each of whom make a unique contribution towards achieving a common goal. And one of the first steps in collaboration is the creation of the assignment of care. In most practice settings, the registered nurse is responsible and accountable in the creation of the assignment and determines who is the most appropriate care provider for the client. LPNs can participate in the assignment of care. However, the RN verifies that the assignment is appropriate based on the client and the care provider. However, this may vary based on the practice setting, and we advise you to connect with both colleges to discuss such a situation if you need clarification on the accountabilities and the roles, like I said, based on the situation that you are in. So it is the collaboration that is so important in considering the scope of practice of both registered nurses and LPNs when you're creating that assignment. And the collaboration starts, therefore, before you actually show up for a shift at your work. That assignment is created, prior to you arriving. So therefore, there are accountabilities that a registered nurse and the licensed practical nurse have in creating that assignment of care based on the scope of practice. So as the RN creating the assignment of care, you need to know your client's needs. You need to know your scope of practice. You need to know the scope of practice of those you're working with. You need to know what you know and what you don't know. You need to know how to manage the outcomes of care so that we're always acting in the best interest of your client, of our client. So therefore, the assignment of care is not a random act. We don't just take a list of staff and a list of clients and just start assigning, randomly or going down the list. The assignment of care is a very important first step. It's where the collaboration happens and is where you really need to consider who is the most appropriate care provider for this specific client at this specific point in time. Considering everything that we have covered thus far in our presentation in respect to, the education of RNs and LPNs, in respect to our legislation, who outlines, what a registered nurse and a licensed practical nurse basically can and can't do.
So, who is providing care to who? When a client is seen to have outcomes that are predictable, this client will be assigned to a licensed practical nurse. When a client is seen to have outcomes that are unpredictable, the client would then be assigned to a registered nurse. So, the collaboration and consultation. The amount of collaboration and consultation between the registered nurse and the licensed practical nurse will depend on the complexity of the client. Licensed practical nurses can care independently for clients who have outcomes that are predictable. Licensed practical nurses care collaboratively with registered nurses when a client's status is changing. If a licensed practical nurse is assigned to a client who has outcomes that are predictable, however, today there is a change in the client's condition, the licensed practical nurse would use their assessment skills in determining the cause of this change. The licensed practical nurse would increase collaboration and consultation with the registered nurse when their assessment findings are not as anticipated, changed, or new. The client is not achieving intended outcomes, or the status is becoming variable or less predictable. Once the licensed practical nurse and the registered nurse have communication and consultation, this does not mean that the client assignment needs changing. It means that additional communication is required in the provision of care for this client. So let's look at clients who have outcomes that are predictable. As a licensed practical nurse, they would be accountable for overseeing this type of client. This is a client who has outcomes and changes that are predictable. They have care needs and a well-defined established plan of care in place, or they have a predictable deteriorating health condition or disease process. So let's have a look at a couple of scenarios. So which of these clients would you consider to be predictable? A client who is, a client who has been receiving dressing changes to a complex wound with outcomes that are as anticipated, or a client who is 2 days post-hospitalization from a mastectomy. The client has increased amounts of drainage with a large hematoma. The client's temperature is elevated and they're complaining of pain. So the answer to this question, the predictable client, would be a client who has been receiving dressing changes to a complex wound with outcomes that are as anticipated. So if you look in the competency profile, licensed practical nurses can care for clients who have complex dressings, complex wounds. But the key is here is that the client is meeting the outcomes of care as anticipated. So therefore, this client assignment could be assigned to a licensed practical nurse. Let's look at a different type of client. So a client is predictable. However, today there's a change in their condition. So an LPN in collaboration with an RN will be accountable for overseeing this type of client. This is a client who has a change in the health condition that has predictable outcomes because this change occurs in the patient from time to time. Or it could be a client who has anticipated predictable outcomes. However, the client's condition at this point in time is not as anticipated. So a little bit more investigation and assessment would need to be carried out there. So a question, who has outcomes that are predictable, but with a change in condition? So would you consider that to be a client who is palliative and had adequate pain control yesterday? However, at today's visit, the client's condition has changed. The client requires breakthrough pain management and is showing signs of agitation and restlessness. Or would you consider this type of client a client requiring B12 injection who has received this in the past without reaction? And the answer to this one is a client who is palliative and they had adequate pain control yesterday, so they've been predictable. However, today the client's condition has changed. The client requires breakthrough pain management and is showing signs of agitation and restlessness. So, because of this change, the licensed practical nurse would reach out to the registered nurse, a nurse practitioner, or a physician to discuss the next steps for this particular client. So as you see, when there is a change in the client status, the LPN is required to communicate that change with another healthcare provider. One must also document this change and the steps taken in providing safe, competent, ethical nursing care. So now let's look at a client who has outcomes that are unpredictable. A registered nurse would be accountable for overseeing this type of client. And this would be a client who has outcomes and changes that are unpredictable. Their care needs are not well defined or they're constantly changing. The interventions may have unpredictable outcomes or risks involved. So let's have a look at some examples of an unpredictable client. So a patient who has a new onset of seizures and the cause is not yet diagnosed. Not sure what's going on with this client. The second is a client who is 2 days post-hospitalization from a mastectomy. The client has increased amounts of drainage with a large hematoma. The client's temperature is elevated and complaining of pain. So that client seems to be more complex, a lot of things going on with that particular client. And the third is a patient with uncontrolled pain, psychological distress, and interventions are not yet working. So we've been trying different things and nothing seems to be working for this particular client. So all of these three would be considered a client with unpredictable outcomes.
So as evident in the scenarios that were just reviewed, team collaboration is essential in meeting the needs of the client. Team collaboration is essential in registered nurses and licensed practical nurses working within their individual scope of practice. So therefore, registered nurses and licensed practical nurses really need to know your client's needs. You need to know your scope of practice, the scope of practice of those you're working with, what you know and what you don't know, how you manage the outcomes of care, and always acting in the best interest of your client. Are you the right care provider for that specific client at that specific point in time? And as members of the team, we are accountable and we are answerable for what we do, for how well we do it, for what we decide not to do. And we are answerable to the client, to employers, to legislation, to working in our scope of practice and knowing the scope of practice of others. And my practice is my responsibility. Those are very important words to reflect on during your day. For those moments when you're considering, is this within my scope of practice? Use my practice is my responsibility as your point to stop and consider and reflect on all the information that we've provided today. Am I educated, authorized, and competent? Because my practice is my responsibility, and I have to practice within my individual scope of practice. As a regulatory body, we have various documents available on both of our websites to support your practice on topics such as scope of practice, and on various other topics that may be pertinent or relevant to your scope of practice. So we encourage you to visit our website to review and use those documents to support your practice. And you will also find on our respective websites contact information for both colleges so that you can reach out and ask us questions at any point. We are available to you to discuss this topic further. So as you can see on this slide, the College of Registered Nurses of Newfoundland and Labrador, we have a website, and it's through that website that you can obtain that contact information. And the College of Licensed Practical Nurses of Newfoundland and Labrador have a Facebook site, which is College LPNNL together. And they also have their website as well for you to obtain that information. So we encourage you to reach out to us and to further discuss. Thank you.
Thank you all for participating. Have a lovely day.